I would like to welcome our guest speakers and our guest attendees. Hello everyone. My name is Maria Mujahid. I am from the Institute of Eastern Mediterranean Studies at Emmanuel College, and I would like to welcome you to the George E. Danis Leadership Seminar in cooperation with the Konstantin G. Karamanlis Chair at the Fletcher School of Law and Diplomacy. This is a seminar focusing on pandemic, citizenship, and Mediterranean city. In the first panel, we were fortunate to have three young innovative leaders who have a reputation of effective governance. In the second panel, we are equally fortunate to have an outstanding panel of three young accomplished professionals in leading global academic institutions, as well as nonprofit organizations. So I have the distinct honor of introducing our guest speakers. Our first speaker is Dr. Natalia Linos. Natalia Linos joined the Harvard FXB Center from the United Nations Developed Program with a wealth of global health and development experience, having worked in the UN system since 2007. Most recently, she led the UNDP's work on addressing complex challenges at the nexus of health and environment, looking especially at the vulnerability of poor and marginalized communities to climate change. Natalia developed the strategy for the UNDP's engagement in this new era of work, fostering closer collaboration with the World Health Organization and established relationships with academic partners and funders, including the Planetary Health Alliance. Dr. Linos is a three-time Harvard University graduate, earning her bachelor's, master's, and PhD. Our second guest speaker is Dr. Eirini Iliaki. Sorry if I mispronounced that. She graduated from the University of Crete Medical School and completed a postdoctoral fellowship and a master's in public health at the Harvard School of Public Health. She completed her residency and chief residency at Cambridge Health Alliance and Harvard Medical School and her infectious disease fellowship at Boston University. She returned to Cambridge Health Alliance in the infectious diseases, medicine and occupational health departments, and as an instructor in medicine at Harvard Medical School. She has been a core member of the COVID-19 response at Cambridge Health Alliance as a clinician and leader in various positions. And our third guest speaker is Ms. Sofia Kouvelaki. She is the Chief Executive Officer of the Home Project. She was the program manager of the Kouvelaki Foundation Program for Unaccompanied Minors and Inter Alia in charge of projects at social welfare provisions to socially vulnerable groups. She has worked at the UN and at the UNICEF in the Economic Analysis and Social Policy Division as an advisor and researcher for the public and private sectors in Greece. She holds a Master of Science in International Political Economy from the London School of Economics and a Master's in International Economics from Sciences, Po Paris. She has completed a Bachelor of Arts in Economics and International Relations at Brown University in the US. And at this time, I would like to introduce our co-host and chair of the panel who will lead the discussion following the initial presentations, Dr. Petros Vamvakas. Dr. Vamvakas is an associate professor of political science and international studies at Emmanuel College. He is also the director of the Institute of Eastern Mediterranean Studies and the coordinator of the International Studies program. Dr. Vamvakas, the floor is yours.
Thank you, Maria. Thank you, everyone, for being here and following up on what was a very nice panel earlier today, as we're trying to put this a seminar of young leaders together and seeing how we are addressing the issue of the pandemic in the city and also in the Mediterranean city in more particular. We heard this morning in some of the issues as far as the challenges that the mayors are facing are challenges that we had seen even before the pandemic, issues of healthcare, housing, food insecurity, safety, education, immigration, and generally living in the city. And in this panel, we're trying to explore the interconnectivity of some of these issues and how we are addressing them through the pandemic, as a lot of those issues are still with us. We are very fortunate to have three experts who are dealing with policy from not necessarily the narrow political space, but outside of that political space, but are becoming more and more pertinent to the policy formulation as we're moving forward today. So I'm eagerly waiting to hear from our three panelists and for the discussion that will follow. I will yield the floor to Dr. Natalia Linos. Thank you for accepting the invitation and starting us off on this discussion this afternoon. Thank you, Natalia.
Thank you so much, Professor Vamvakas, and thank you to my co-panelists for being on this panel. I think I very much enjoyed the morning conversation with the mayors, and I'm going to set the stage a little bit as an epidemiologist, as someone who maybe a few years ago, people wouldn't know what an epidemiologist does, but sadly, COVID-19 has made us, in the forefront. I want to begin by saying that when public health does its job right, we're usually invisible. It's the work that happens behind the scenes on prevention to ensure that our kids are living healthy lives, that they're not dying in childhood, prevention in the sense of ensuring that our workplaces are healthy, that our schools are healthy, prevention to ensure that our neighborhoods are a place for well-being. But when something like COVID hits, a true pandemic, one that caught us all unprepared, whether we are in Boston, where I am right now, or in Greece, or in Cyprus, or in Italy, or across the world, the reality is that public health has to step up and has to step forward. I want to start by saying that public health is not the same as healthcare. And that's a distinction that is important because we often think about health as being treated in hospitals by doctors and nurses. And we're so lucky to have Dr. Iliaki with us today because she will speak about that portion. At the beginning of this crisis, it really was about how do we get people to the hospitals and out of the hospitals. People were dying, we didn't know enough. But public health is about how do we create systems to ensure that people don't get sick in the first place. And as a social epidemiologist, my career has focused primarily on what are the conditions outside of healthcare that create health. So early on in the pandemic, in March of last year, before there had even been a death in the US, I wrote a piece with Dr. Mary Bassett, who was the former New York City Health Commissioner. I worked as her science advisor there at the local level, around what we were afraid of. And as social epidemiologists, we knew that pandemics often emerge along the lines of our vulnerabilities. And what are these vulnerabilities? True inequality, income inequality, social protections that don't work. For example, in this country, in the United States, not having paid leave, not sick leave for people. So how, workplace issues, homelessness, issues around food insecurity and housing insecurity, these were the vulnerabilities that we were most concerned on. And in the United States, we also highlighted quite early on, what we feared the most is that this pandemic would bear a bigger toll on Black and Brown Indigenous communities. And in Europe, the School of Public Health at Harvard, where I work, the center, we have a Roma program. We were very concerned about the Roma population in Europe. So early on, we sort of, sounded an alarm and said, we don't have any deaths yet in the US, but the deep vulnerabilities of our systems, systemic failures, not in our healthcare alone, although there are many in the healthcare, but outside of that, we're posing real threats, and governments needed to step up in a comprehensive way to provide not just testing in healthcare, but also measures to ensure that people could live healthy lives. And a big tension that has come out in this pandemic is personal responsibility on one hand versus policies that make people able to live. So who is responsible for health? Is it me as an individual, I'm told to stay home, or is it my government that is supposed to provide measures to enable me to stay home? And as a social epidemiologist, my concern has always been, are we able to follow public health measures? So early on, we said, stay home, buy 3 weeks of supplies of food, wash your hands, don't go out if you don't need to. But there are so many people that simply cannot follow those rules. If you are living on a refugee camp, and I'm sure Ms. Sofia Kouvelaki will talk about that, if you are an undocumented immigrant, if you do not have employment that allows you to stay home when you are sick, it's pretty much impossible to follow those rules. So there is something to be said about personal responsibility, but there's a lot more to be said around policies and how do we create comprehensive policies that enable people to stay home, to follow public health guidance. And that created tensions. And there were tensions here in the US, there were tensions in Greece around, the economy versus public health, listening to scientists versus listening to people who were desperate, and then these trade-offs. And I think it's important to be honest about trade-offs. And I'll give a personal point here. I am a mother of 3 young kids, a 7-year-old and 3-year-old kid. So one of the trade-offs that was really felt deeply for me at home was school closures. If schools are closed and I need to work and I have 3 kids at home, how do I do that? And the gender equality piece of this pandemic, I think, is really important too. We know that women have been at the front lines. They are more likely to be caregivers in terms of in workplaces, in healthcare, they're more likely to be teachers. They're also more likely to be caregivers at home. And because of our inequitable, wage differentials, women are the ones who are more likely to stay home if one parent has to be working and the other has to be giving care. So there are so many long-term impacts of this COVID pandemic that in many ways, COVID has made so obvious. But my hope, and I think one of the mayors talked about sort of, using a crisis to reform, to put in place new measures. So before, closing, I just want to say, what would that look like? What does the future look like? A future that would enable us to not have another pandemic like this. Of course, there's the pandemic preparedness, and I'm sure in our discussion we can talk about that. Of course, vaccines will be part of the solution, but much more than that, it is how do we set in motion systems to ensure that people don't have to make those trade-offs of going to work sick or putting food on the table, or losing their homes during a crisis, or women having to leave the workforce because there is no measure in place that has targeted their specific needs. So in conclusion, I'm just looking at my notes. The big picture is public health. When it works, it's invisible. When it doesn't work, we're scrambling. There is this tension between personal responsibility and the government policies. And I am more of the, what can government do? There are trade-offs that are real and we need to talk about it. And moving to the future, we need to think critically about whether we want a public health policy that is around zero risk or risk reduction. And before we started, Ms. Kouvelaki was saying that in Greece, right now it's summer and people are outdoors. We do need to think about our policies and how we structure policies that people can follow. So we know that outdoor is less risky. How do we enable that? We know that indoor is more risky. So in our conversation today, I'm happy to get into some of that tension between risk reduction, harm reduction versus eliminating risk. Because realistically, when something has taken us over a year and will be, at least in the immediate future, part of our lives, we may need to move to that mode of thinking, not eliminating risk, but reducing risk. So I'll stop there for the other panelists, and I'm so glad to be part of this conversation.
Great, thank you very much. Dr. Iliaki.
Hi. Can you guys hear me okay? I had some technical issues before, this is why I'm asking. Okay, if at any point you cannot hear me, just let me know. I have some alternatives here. I'm also thankful to Dr. Vamvakas for organizing this, to Mr. George Danis, and I appreciated very much the previous panel by the esteemed mayors of Athens, Syracuse, and in Cyprus. And I'm also very, very happy to be amongst the 3 of us here, women scientists. And I was asked to not use slides as I'm used to as a physician, although I do have a lot of pictures, charts, x-rays, to try and depict the pandemic through the eyes of an infectious diseases doctor. I just want to highlight some aspects, again, in a few moments, throughout this year, throughout this pandemic. Again, I'm an infectious diseases doctor, and I work in a hospital and a primary care system here in Massachusetts. As you know, Massachusetts is about 7 million people, so a little bit smaller than Greece. Our catchment area is 9 cities, encompassing more than 350,000 of population. And some of the cities that we serve are poorer than others, and our patients may not be as privileged as in other areas. I want to focus on principles, and I will speak about 6 principles of an infectious diseases doctor throughout this unprecedented pandemic. I want to start by the lens of, we were asked from the very beginning to assess the science. And assess science in a pandemic means assessing new information constantly and having to decide if what we're learning is enough to change course, change what we're doing, or do we wait for more science or more data to guide our management and overall policies? Always with do no harm in the background. The second overarching principle that we found ourselves into was that, yes, we assessed the science, and now we also became the messengers. Now we have to translate the message clear, to emphasize being flexible with our message, and also to translate science into this concrete advice, making sure we explain why we are making such a recommendation in an ever-changing world of recommendations. I will give you an example. In the very beginning, we said it is not necessary to walk around wearing masks. And this was because, based on our prior knowledge of coronavirus epidemics with SARS, with MERS, one was not transmitting unless they were sick with the disease. And in this case, we said, well, if you're sick, just stay home, call your doctor. Also, we had a shortage of medical grade masks. So it seemed the right thing to do to not recommend masks. When we learned that one is most infectious 1 to 2 days before the symptoms, even that first day when you have very minimal symptoms and you wonder if you're sick or not, then it became evident we had to change course. And that could have been easier if we, from the beginning, explained our reasoning for the first recommendation. Thirdly, we learned that as infectious diseases doctors, we had to be present and available in a very large scale. We had to be present for our CEO in the hospital when he's trying to craft a message and the policy, but also present for our workforce, make sure they're safe so that they can keep our community, all of us, safe. We had to be present and answer questions, not only from our fellow physicians, but also from the janitor cleaning the hospital floors. We had to be present in a larger scale also as clinicians, doing our day in and day out job, assessing patients with infections. In this case, when our hospital was flooded with COVID-19 patients, we were called for every single patient admitted with COVID-19, hearing over and over again the painful histories. Even as of yesterday, a 45-year-old man admitted with COVID-19 symptoms, now struggling to breathe. What treatment shall we institute? We, as infectious diseases doctors, would have to approve the very expensive antiretroviral remdesivir and have to make these decisions constantly. We also found ourselves as educators. First of all, educate ourselves on our spare moments, continuing to read the latest literature. My family knows very well that Saturday at 3 p.m. and Sunday at 3 p.m., mommy locks herself in her room because I have to attend the CDC clinician's call and the Society for Hospital Epidemiology call and be up to speed with the latest developments in my area. We have to educate our fellow clinicians, but we also have to educate our communities. They want to hear from the specialists. And myself, as my colleagues, have participated in countless of these meetings. A webinar with a homeless youth shelter, a webinar with homebound elders and their relatives, questions about vaccines, immigrants, and questions about vaccines. We also have to be educators for our friends, for our family. There's no such thing as, we never stop to listen and answer questions. Be there. Fifth, advocates. So now that we are assessing the science, translating that message, now is also an opportunity for us to translate what we're seeing into a cry for help, other than the very strict medical aspects, about the aspects that Dr. Linos specializes in, all the social aspects that come with infections. Infections and inequalities are an issue since antiquity. We know that the most vulnerable suffer the most. In addition to that, on a global scale, so as infectious diseases doctors, we can also advocate globally. I am a member of the Consortium of Universities for Global Health. I participated in speaking to senators, congresswomen, and congressmen about global vaccine equity and what the US can do to promote that. And on a local level, signed endless petitions to stop evictions, to promote paid leave for workers who get sick. And lastly, what we learned is we have to think outside the box and be innovative, be resourceful. And this is institutionally what happened here and in many other places. But from the very beginning, when we saw the pandemic was hitting our door, we converted our system, as I said, as a very large catchment area, and converted everything into telehealth. We gave an avenue to our patients to call with questions. We created a clinic dedicated only for patients with respiratory symptoms so that they don't flood our emergency rooms that were already flooded with persons who were struggling to breathe. In that process, we also kept in mind and tried to cover social needs as well. For example, we linked our patients into food assistance programs because we realized, again, the most vulnerable was getting sick. In the hospital level, we doubled our intensive care capacities. Since our regular surgeries were put on hold, we used our pre-surgical waiting areas into intensive care units. We redeployed staff. We had shortage of personal protective equipment, but we used science. For example, we had UV machines, ultraviolet machines that we used to radiate and clean surfaces in patients' rooms. And we transformed them into machines that were disinfecting our precious N95 masks so that we never run out of precious equipment. We used research. We, in the occupational health department, took note of every single of our employees who got sick. We were there for them. We analyzed their data and we used the data to educate ourselves and to find out that, for example, number one, once we instituted a universal mask policy along our staff in the hospital, we flattened the curve of infections. And this happened before Massachusetts instituted a mask mandate. Our staff was always using masks and appropriate equipment with patients, but they were not using masks when they were interacting with one another. And that was precious information that, as you saw later on, actually held true because cities and places that had mask mandates did much better than places that did not. And we found that out very early on. We also found out that most of the infections of our employees started in their communities and not from the hospital. So we were able to educate, reach out. Lastly, the impression that I am left with as an infectious disease doctor in the face of an unprecedented pandemic is this of respect, is this of being very humble, and also, although realistic, very positive. I have seen incredible strength, transformation, and now with the vaccines, I can truly say that there is light at the end of this tunnel, as long as we are positive, as long as we accept that vaccine as soon as our turn comes. And with that, I want to close, and again, very thankful to be amongst all of you today.
Thank you very much for those very enlightening words and the figuring out the process. And I think moving forward, we're shifting gears and continents, I think, as we're going to go to sunny Athens and look at this issue of the pandemic from a completely different perspective, but also at the same perspective as, this issue of vulnerability is something that's very, very prominent in our discussions today. Ms. Sofia Kouvelaki, thank you for being here. The floor is yours.
Thank you, Professor Vamvakas, and thank you, Mr. Danis, for this very, very interesting invitation. And I would like to thank my co-panelists. I'm very happy to be with all of you here today. And I would like to invite you and our audience to travel, as you say, across continents and from the world of science, which we need so much during these times, to a more of the ground, let's say, reality. So the Home Project is a non-profit organization. We started 4 years ago with the mission to provide support, protection, education, and social integration services to unaccompanied refugee children. So to refugee children that travel and arrive alone in Greece and in Europe. At the moment, we are operating 14 homes, shelters, where we accommodate a total of 270 children, from newly born babies to 18-year-old girls and boys, and we have created a shelter for 18 plus. The ultimate aim of our intervention is social inclusion. We do that by implementing a model that is based on 3 pillars. The first is that we provide a holistic network of child protection services through an individualized approach to all children that pass under our care. Since our beginning, we have supported more than 600 kids. So we do that by not only by covering, basic needs like food, accommodation, medical support, but we give emphasis on what we call human development, which entails social support, education, mental health support, and social inclusion. Now, 50% of our staff comes from the refugee and migrant community, and now after 4.5 years of operation, we are in a very pleasant position of being able to actually hire some of our kids that become 18. And the third element of our work is that we find buildings that have been abandoned or unrented for a very long time. We renovate them, adding value to the real estate property, and then we pay a property tax and a rent to the owners. The idea really is to create a win-win situation for everyone, for the refugees, for Greeks, but also, for the neighborhoods where we operate. So we work very closely with the neighborhoods in Athens, like neighborhoods like Kypseli, Πλατεία Αμερικής, Άγιος Παντελεήμονας, Καλυθέα, Daphne, Petralona. It's an urban intervention, and this was our strategic decision because we wanted kids to have access to services. Now, COVID, as you can understand, has completely, influenced everything that we do. First of all, as Dr. Linos said, we couldn't stay home because our work is, creating and providing all of the services that constitute a home for these kids. So the challenge for us in the beginning was, how do we protect our staff? How do we protect the kids, and how can we keep providing the services that we are providing, not eliminating, but reducing the risk as much as possible. And in the beginning, no one knew, even, we were all, new in this coronavirus experience. But we had to take immediate measures, and we had to be as autonomous as possible, because there wasn't enough equipment, not enough masks, not enough, antiseptic. So we had to find that. We got a donation even from China for masks to be able to cover our staff, all our staff, and our kids. And then it was the question: how much do we test? How often do we test? How do we adjust all the operations of our home in order to reduce risk as much as possible? And to that, we didn't have clear answers. And even to that day, we still don't. So what we did, we had to move really efficiently, really fast, and to be as autonomous as possible, because we are dealing also with the problem, within the context of the refugee issue. These children, in reality, are invisible children. So there is an institutional gap of child protection. There was always an institutional gap of child protection, even before the coronavirus. Now you can understand how this gap has been exacerbated. So we had effects on our legal support, our healthcare support, educational support, operational issues, staff issues, so because all of our kids are asylum seekers or eligible for family reunifications to be reunified with their families all across Europe. And there are significant delays in the processing of these asylum claims. Now, what that creates is a significant delay in the issuance of what we call PAIPA in Greece, which is a social security number that enables children and adults to have access to healthcare. And right now, the majority of our kids don't have this number, which causes extreme difficulty in them accessing healthcare, schools. I mean, most of the kids that have arrived during the lockdown don't have this number, so that we can't register them at school. So what we had to do is become even more autonomous as before, and try not to compromise the quality of our services while reducing risk as much as possible. And that's a challenge, because everything that was done, through human contact, education, our community building elements, everything had to happen online. And we also operate in areas of Athens where the network is not that good, not only for our shelters, but for Greek kids that live, in Acharnon or Agios Panteleimonas. So there's a big percentage of children that don't have equal access even to online education. Then we've seen that there is, an exacerbation of the mental health condition and the medical condition of kids, with medical conditions, when everything is done online, when they don't have, this socialization element, they're not able to be outdoors as much as possible. So we had to increase our whole mental health component and find a way to substitute for the missing social welfare state in terms of medical support, access to the normal vaccination. So we have been trying to push for some kind of a prioritization, at least for our staff, because we have experienced many quarantines, and you can understand how challenging it is to quarantine a structure, a home with 16 children. And when we have an outbreak of COVID, our staff has to stay in. But our operations are not hospital operations. Our staff works on an 8-hour basis. So all of a sudden, we had to integrate at least 3 to 4 members of our staff in each home, staying with the kids with the relevant equipment. And actually, all of a sudden, we had to not to demand, but to ask our staff to quarantine for 2 weeks at home, leave their families, leave their own children at home. I mean, luckily, we have incredible staff, we have an incredible team, we had many volunteers who wanted to do this, but that should not be a given. So I think coming back to the policy elements, we should all work together. I mean, and involve all relevant stakeholders to really design COVID policies for vulnerable groups, for social welfare structures, for social welfare units and homes like ours, and decide what are we going to do with vaccination? How can we keep providing quality services while reducing risk as much as possible? I mean, we don't have answers to all of that, and I think we need to start finding those answers as a society on a national and on a global level, because what this pandemic has proven is that we're all interconnected. What happens in Boston influences what happens, in a child in Patricia here in Athens. So I'm very, hopeful when we have this kind of panels and these kind of discussions, because we need to exchange, involving all stakeholders from different sectors, but then, coming back to the policy elements and really starting to design policies that ensure equal access to healthcare and protection.
Thank you very much. And Mike, it sounds like where the approach that has been taken in a lot of these issues, that the issue of of meeting this pandemic to begin with was sort of like the message is the same as far as lack of preparedness, and then the other message is like the flow of information seems to be jagged, but the major issue is that this level of inequality that's pervasive, and I'm not sure that it has gotten better, but it has gotten deeper and bigger. And I can appreciate the normative aspect of it, what ought to be, but it just seems that there is still a securitization approach of dealing with this pandemic, even a year later, rather than a social approach to dealing with this pandemic, right? Like this continuous lockdowns and how restrictive they are. And I think the question was raised earlier, but by Natalia to to the mayors as far as how do we go beyond? How do these lockdowns affect people who are in the margins? People that do have to go out and they do have to provide this help. And I don't have a clear sense, even halfway through this panel, how do we actually do it other than what we should do? But how do we actually accomplish this? Because I read the papers myself and I see that Jeff Bezos has gotten a lot richer in the last year or so, and worker rights are a lot worse in his warehouses, and we are part of it because we are like on the other end of that chain as far as consuming the way that we're consuming. So I'm not quite sure after listening to the panel so far, how do we actually do it? And maybe you guys have a better sense of it since you're on the ground in the laboratory or on the ground with helping children. So I don't know if you have what do we do?
May I, Professor?
Sure.
What I hear, at least what we hear, is really the policies, preparation, political execution, and involvement globally to alleviate and improve both the securing the public health from happening, but also prepare, because sometimes you cannot prevent some of the virus and some of these emergencies. And so I believe that both political leaders and the citizens of the global sense are somewhat responsible or unprepared to do, because I hear from the three panelists that really we're not prepared. We are not aware of the problem, and so we take it very lightly, the hard work that the epidemiologists like Dr. Eirini is pointing out, and Dr. Natalia, of how vulnerable and how much needed public assistance or public health that can prevent some of these, or at least alleviate some of the pressures and problems. And Sofia's situation with the immigration, especially with the children, it is a heartbreaking that we have come to this situation, and learning now with this pandemic, global pandemic, that we are so unprepared, and we have allowed some of the world to be exonerated or to be protected, and we have ignored some of the needs of the people that both need the help, but also are part of the system that helping the system. So I still believe, and Professor Vavakas and I, actually, I wanted to really thank Professor Vavakas for the hard work that he's doing to be able to, and initiating these public forums, and he and I can work together. But I feel that we still need to pressure the political leaders, the leaders of the world, but also the citizens of the world, to demand from the elected officials more equality and preparation, and be able to prevent and help this situation. Thank you very much for the information that I got, and I really appreciate it very much.
Maybe I can jump in with sort of a response to both of your comments, which are very helpful. And I agree with you completely, Mr. Danis, that this is a political decision in many ways, but the public has a role to play. It has a role to play both in complying or trying to follow the public health guidance, but also in pressuring for more radical change. And I use radical in a positive way, not a negative way, radical to set us up for a better future. To your point, Professor Vavakas, lockdowns for the public health community are an essential tool when we have run out of every other measure. And it's hard at the beginning. And I think, Dr. Iliaki brought that up. We didn't know. We were confronted with a novel coronavirus that was hitting people harder than we had ever expected. We were seeing our hospitals being overrun, the whole flatten the curve language. It was the beginning stages of the COVID pandemic. A lockdown was essential because we needed time to figure out what was going on. We needed to, sort of remove some of that anxiety that our frontline healthcare workers were seeing. They were running out of beds. They were running out of ventilators. And this is in the US, one of the wealthiest countries. Some part of the world, we had, heads of state saying, I have 9 ventilators for my whole country. So lockdowns were an essential measure to buy time, to buy sort of an understanding, to figure out what we needed to do. Now, more and more, the public health community is saying lockdowns should be used as the last resort. And many places are still at that place. In our country, in the US right now, Michigan might be one of those. There is a push for that. I know in parts of Europe, there's a second, third, fourth wave, we might need to use lockdowns. But during the non-lockdown periods is what can we do to put in place measures that are what I called harm reduction measures. So I personally believe that we should not have indoor dining, but during nice warm weather climate, outdoor dining is a safer alternative. It allows people to work. Should we have schools? That's a big one. I personally, again, feel that schools that have the ability to do more outdoor learning in bigger classrooms, not have 30 kids in a small classroom and abide to mask wearing, that there are ways to have safe, and that's what the CDC is saying too. So there are measures, and we might have to prioritize some industries versus others. Now, the big question happens is what happens to those industries that you don't prioritize? Are all these people going to lose their jobs? Are the economies going to go under? And what do we do? And I think the answer depends very much on what, where you are on the global scale. For a country as wealthy as the United States, we can afford to pay people to stay home. That's what they're doing in some Nordic countries, New Zealand, like you can pay people to stay home. Now, for countries like Greece that were already in, a dire economic situation, I think the answer is harder. So I don't envy poor countries or countries that don't have the means to say, we are going to take on this kind of really radical pay people to stay home because we know in the long term our economy is going to work. And something we haven't spoken about is why, we alluded to it, and Dr. Iliaki said that, the light is there at the end of the tunnel because of vaccinations, but even the vaccination inequities that we are seeing globally, who has access to vaccinations, will mean that some countries are going to be able to get back to business faster than others. So we need to be talking about vaccine equity. So there is no answer. I think what the public demands, and this is to Mr. Danis's point, is that scientists and politicians are transparent, that we talk about what we know and what we don't know. And we've seen some really strong leaders, whether we're talking about New Zealand's, Jacinda Ardern, or other people who have stepped up and been honest and been saying, this is what we know, this is what we don't know, this is why we need you to be patient. But from a perspective of, an individual, I can see why people are tired. But we're not out of it quite yet. So we do need both the public and our policymakers to find ways to balance those challenges. And I think I'm optimistic because it's the summer for our hemisphere, at least. And so outdoors is a safer way. So I'll stop there. Not a very satisfying answer, I'm sure, but I hope the others can jump in too.
So to the point of Dr. Vamvakas and Mr. Danis, it's also a point I have been thinking a lot in terms of how can you actually do it and not just say, yeah, it would be great to do it. But as a physician, what I am finding out is that what we could do better is be outside our offices and be out in the community more frequently, consistently, and build trust. And I think that's part of, that's a long-standing task, so that when emergencies hit, you're not a new face jumping in to say, well, listen, you have to do this and you have to do that because I'm saying so, trust me. But it has to be a more long-term relationship with the public. And I say this as a physician, let alone politicians. So I think that's the other aspect where, I was very excited about, some of you know that Dr. Linos was, one step away from getting into Congress, and why I was very happy about it. But because we need politicians to do the same, be there for the most vulnerable as well as for those well off. That's one thing I learned. And the other thing that Dr. Linos spoke about, this notion of harm reduction. Being in the infectious diseases world, for example, HIV, in the very beginning, we were saying no sex, no kiss, no. And as we were learning more, of course, and knowing human behavior and the social aspects of our behaviors, which also this virus is attacking, we learn more and we can adjust that message. And I could not agree more that science now says outdoors is so much better than indoors on anything, whether you interact in a barbecue or eating outdoors, teaching outdoors, everything outdoors. So adjusting that message. But again, you need to have that trust built in. And I think this is a point where we have to work on building trust.
If I can follow up on that exact word, trust. I mean, trust needs a lot of work, and I think it's a bottom-up and a top-down work that needs to happen. Again, involving and engaging different elements of society. Coming back to the domain of social vulnerabilities, I think we are living at a time that we need solid public health policies. We need to build this trust, but then, we need a new framework of social policy. We really need to review our social policy strategies all over the world, on a national and global perspective. And from our experience, now it's the time to really be conscious about the interconnectedness of our world, and really make the invisible populations visible, because they influence everyone. So it's to the benefit of all of us to really include, vulnerable groups, immigrants, the Romas, these populations that, are not even officially registered in different countries. And I know that's very challenging, when ICU beds are full and when the whole of society is in crisis. But what happens in those neighborhoods of Athens, the poor, marginalized, almost invisible neighborhoods, is going to influence what happens in Kifisia or in Ekari or in the center of Athens. And then when we want tourists, in mid-May, what's going to happen, in Acharnon might influence a tourist living in Asteras in Vouliagmeni. So I think that we should review our social policies, and we should take immediate measures to really place a focus on these populations as well. Otherwise, I don't think we can be optimistic and hope for a better future.
I mean, I agree with the optimistic aspect of it. Maybe I'm a little bit more jaded, but I hear the policy as far as, and I think the mayor mentioned it earlier, as far as what's going on in Greece right now, vaccinating islands that are, 10,000 and less. And in that way, you're creating like the reversal of leper colonies, like you're creating like tourist colonies, So you have like this island that's used in a reversal, like the island, the show that was in the book, and then the show that was popular on Greek television, which was sort of like a leper colony off the coast of Crete. And now we're creating colonies that are different. So even, Ms. Kouvelaki mentioned the issue of access to Wi-Fi. So it's the same kind of a thing here in Boston. Like it's a different Wi-Fi bandwidth in Chelsea as it is in this side of the bridge. So and that was my point as far as this exaggerated inequalities. Like over the last year, you guys have been in the forefront of the communication with policymakers, whether it was just try to get some more funding, some more resources for unaccompanied minors, or the CDC discussions that Eirini is having, on Saturday and Sunday night, or Natalia's attempt to get involved in the public sphere. So what is your experience as far as being able to influence that policymaker on the other end of the line, whether it's for masks or for running for office or listening and getting information returned back, because I'm sure it's not just receiving information, it's also giving it back. We can go either way, or you could just let the question go.
I'm happy to jump in again, although I'm happy to give the floor if someone else wants to jump in first. All right, I'll share that, I did run for office, and that was a bit of a strange move. In the midst of a pandemic, I was finding myself giving interviews at the New York Times and writing papers and sort of calling on better policy. And at some point, it occurred to me, there was an open seat for Congress in my district, and none of the people who were running had any of this expertise. They were all the typical sort of people who run for office, lawyers, people from business. And I looked at Congress as a whole. They were going to be making the decisions about, as they have, the CARES plan, the future, and really needed to understand COVID in order to understand the epidemiology. And yet we had very few scientists. Our political system here is very very few scientists, very few women with young children, very few immigrants. There were many tick boxes. So I said, I'm going to step into a race and go forward with a call for more science and more equity. And it was very well embraced. It was very well embraced by the communities that I was representing. And it was interesting that it was seen as apolitical, even though I am, very clearly a Democrat and very clearly left on the Democratic side. But this, desire to have a scientist was actually embraced by people of all political spectrums. I got, donations and support because there was this appetite for, how do we do evidence-based policymaking in the midst of a pandemic, and how are we going to get out of this? This isn't a 2-week thing. It's not a 1-month thing. This is a 2, 3, 5-year thing, and hopefully a rebuilding of our system. So I stepped in personally, and, behind me, there were people like, everybody on this call, there were people who were experts and scientists. I was so excited to have that support. I wasn't successful, but it wasn't for naught. Right now I am engaged in panel discussions with communities, with unions. In my community, I'm going to be in our town meeting in Brookline. The three of who were mayor candidates for Boston, Michelle Wu and Andrea Campbell and Jocelyn Siago all wrote to me and said, can you review my COVID plan? We need you to be involved in this. So, there is this appetite from politicians to engage with scientists. I do think that it's there. The challenge, and, we heard it in the morning, was this, like, let's listen to scientists. The challenge when the scientists don't agree is that it's difficult to listen to science. If there was a single message, unfortunately, even within the science community, because that's how science is produced, there's a lot of debate. We're not talking about a pandemic that we have consensus over. So there's some debate even in the science community. So I need to be honest that, when you say listen to scientists, it's not that easy when we are constantly learning. But I do think that the public and the politicians want to do better by science, but unfortunately we have also politicized some science. Like basic science, like wearing masks in the United States, has become political. It's a sign of whether you're a Republican or a Democrat. And even on vaccines, at first there was this fear that it would be communities of color that have real history with mistrust in institutions because of the Tuskegee experiment. There was a big worry that Black and brown communities would not have the uptake. Right now polls show that it's actually white evangelical men who are less likely to take the vaccine. And it's really the politics, not the history of mistrust. So again, to complicate your answer, there isn't a clear path for science and politicians and social policy to come together. But what I took from the morning discussion was every single mayor talked about the role of civil society and the groups that they were bringing in, the NGOs to deliver. And so I am hopeful that kind of future, that how does science, politics, and civil society come together to build a better future? I am hopeful. And this is sort of what you have in this panel, 3 of us who represent some different angles. Thank you.
Thank you. Eirini, you want to go next, or?
Yes, sure. Yes, so, I think from the beginning of this pandemic, there was this false dichotomy of the economy or the virus. And I think for us as scientists, it has been the biggest challenge working with politicians who then, whose message then will transport to the public, is to erase this false dichotomy and to promote the understanding of, through antiquity, when pandemics happen, people, unfortunately, they are trying to just make ends meet, and they are trying to survive, and they are not going to use hospitality venues and party, and that's kind of one of the very hard realities that just come with it. And they will bounce back, and there will be bouncing back. But in this acute moment, it's just to kind of separate out, we're all in this together, and how each one of us can play a role, even persons, who work in the hospitality venue, how can they be helped to either offset their costs or transform what they're doing to survive. in a more global level, I think there is interest, of course, and politicians are starting to understand the global feature of pandemics and interconnectedness overall. And I think they seem eager to hear what scientists have to say. And I think things are changing, and I think legacy matters. And I see politicians who want to leave a positive legacy. And I saw senators that were very eager to be the ones to propose a groundbreaking way of helping poorer countries, for example. So I want to say that my overall impression is positive, and just the more politicians are open to hear, then the better.
Thank you. Sofia?
On our from our end, I mean, we were lucky because this government before COVID put a huge emphasis on the issue of unaccompanied minors. There was a special secretariat for unaccompanied minors that has been created within the Ministry of Migration, which has made the issue, has pulled the issue up on the political agenda. I mean, there is still a big child protection gap for unaccompanied minors. From the 3,854 children, unaccompanied refugee children that exist today, as we speak, there are 1,200 that are completely homeless. So in the streets, completely unprotected. So the problem still exists. However, there have been some very positive steps, in terms of, recognizing the issue, putting it up on the political agenda, agreeing on a relocation program with other EU countries. Last week, we had the announcement of an identification mechanism for those homeless children. So there are steps in the positive direction, and policymakers are open to dialogue. I mean, now we have the huge challenge of integration. How do you integrate these people in the midst of a pandemic, when there's no access to healthcare, no access to education, when some of our kids who turn 18 can't even open a bank account, even if we have found the employer. So challenges still remain, but I'm also optimistic because it's, from small victories, there is progress, and it's a victory that this government has recognized the issue, is taking steps to do something about it. But there's also the need for the EU to step in and help Greece deal with this issue. But also, again, coming back to politics, we need an integration strategy on an EU level and on a national level, taking into consideration this pandemic. And so there are still many challenges to be resolved, but I think there are steps in the positive direction. I mean, we are experiencing that with, the progress I mentioned. We saw that from EU countries like the Netherlands, who funded 3 new shelters that we opened in the midst of the lockdown. So I think there are baby steps in the right direction, but there is lots of work to be done still.
Did you say, I'm sorry, did you say like 1/3 of the minors are they're homeless now? 1/3?
Exactly.
Wow.
It's 1,200 children are homeless from the 3,800, and these are completely invisible children. So you can understand, if we have problems in the shelter, providing support and taking all COVID-19 prevention measures, you can understand how exposed these kids are, not only to COVID, but to everything else, and to all kinds of abuse.
Yeah. I see Mr. Danis, but I do want to follow up, and I'll give you the floor, Mr. Danis. I mean, that's the kind of a thing, though, that it creates this issue of like lack of trust, right? We were just saying, okay, there is this policy, and even like this lockdowns, as Natalia was saying earlier about the where we should be dining or not dining, and then you hear like the public transportation system is just like overcrowded. or a lot of people don't have Wi-Fi really to go into like distance learning. You don't necessarily have an option of working from home. And that's the majority. This is not like a minority of people, right? So it's like, you talk about 1/3 of like, if we are in the middle of this pandemic as we are, where everyone is a possible spreader of the pandemic, you have like 1,200 children that are sort of like, hovering out there. It's really like, I think that's, I don't know, it just caught my attention when we were saying that, Anyway, Mr. Danis, I'm sorry.
No, please. It's a very enlightening conversation, and what I hear is really obviously remedies, but they're reactionaries. When we have a problem, we react, and reacting never really accomplishes the ultimate goal. We need to be more visionaries. But again, I think the public and the citizens of the globe has to demand from the political leaders, especially in democratic societies, that we have a voice. Now, whether it's Dr. Linos' desire to become a political, it doesn't really, to me, it doesn't help just to know to be a particular expert on something in the political arena. You need a visionary to look at the broader management of government and government funds, and this is what I see has been lacking in our government for a long period of time, including in Greece. Obviously, we already know the situation economically, but so including the vaccine, for instance, the development of the vaccine, I believe that if the government of the vaccine producers could and should have really put more factories to produce vaccine, would have billions of doses out into spread or to ship and donate to the world. We haven't done that. So to me, it isn't how much money you put into the market liquidity, it doesn't go into the right areas to be able to prevent or to remedy the situation and prevent the future. Preparation, and it's become really a situation that always say prior preparation prevents poor performance. And so I think, and we also as citizens, and this is why I was convinced by Professor Vavakas to commit to be more vocal and to be more informative of what's happening out there. And in fact, this particular day that both the three mayors, including the panelists now, has given more data, more information to understand. And so we really need to elect critical thinkers and visionaries to look at and manage the policies rather than just make a policy and you think you already solved the problem. No, it isn't that easy. You got to manage it first. Thank you.
Absolutely. Yeah, I mean, from an epidemiologist perspective, I mean, Natalia, when Sofia says this, that there are so many children out there and so many people out there. I mean, what does that mean from a public health and a healthcare issue? I mean, like, it's.
I mean, to be honest, my first reaction isn't I'm worried about these children spreading disease. I'm worried about their health and safety, being, trafficked, being, like really, I put on my child protection hat. That is, it's much more risky for them than they are for all of us. From an epidemiologist perspective, how the disease spreads is, close quarters, it's workplaces. We saw in the US in, meat packing, it's prisons, it's nursing homes, it's congregate settings is one thing. But then, yeah, if you're homeless or whether you're a child or an adult, you don't have that self-protection. So it's they are at risk of getting sick rather than necessarily being vectors. And I think, and I bring that distinction up because with a lot of the public health discourse, and I work at a center that works on health and human rights, is that we sometimes see people as vectors of disease, and there's this in the US, anti-Asian sentiment, in Greece and other places, anti-Roma sentiment, anti-immigrant sentiment, as if they are the ones who are going to be the transmission. So we have to be very careful in public health to not put individuals as the vectors, but recognize that it's the situation that we have created. And that's where I was bringing up this individual responsibility versus state responsibility. The fact that these kids are homeless, we shouldn't be saying, oh, they are now vectors. I mean, we could use it politically to say, okay, we need, it's safer for them to be housed, but we should all know that if they get sick and they pass a disease, it is not their fault. We have failed them, and we have put them in vulnerable situations for a lot of other harms. And I'm sure Sofia can speak to those harms more broadly. But as an epidemiologist, it's very important to be clear that people are not vectors. Disease is passed on. We, especially from what, Dr. Iliaki said, because we're passing on this, there's this, you're passing it on even when you don't know you're sick. There isn't really much you can do other than ensure that people have the means. They have masks, they have sanitation, they can stay home. If they have to work, their workplaces are designed in a way that there's good ventilation. Public transportation, I do believe the government can do a lot to have more public transportation, more frequent buses, opening doors, creating other models of, smaller group transport. Say you have factory workers that they're going to be working together, you transport them all at the same time, so you're not mixing people from different groups. So there are strategies. And to Dr. Danis's point, yes, we need visionary, we need follow through. And I'm just going to throw in the plug that in my sort of COVID plan, my forward-looking follow-through was climate change. And I know we haven't talked about it, and I don't think we should go there right now, but really, we're going to be investing so much money in building back. If we don't put the investments in green jobs and green buildings, we're going to have a crisis in a few years down the line that is of similar magnitude. So let's be smart today and ensure that the investments that we're making today are both social investments, but also green investments. Otherwise, our next crisis is really going to be a climate crisis.
Absolutely is here. And however, is really, you have to manage how you jump into the clean energy. And we're all for it. And I totally agree 1000%. But if you stop the present energy system, you won't have a planet. So it's a long-term sort of been started in the beginning of the century and even before, but it hasn't. So we really need to start.
And Natalia, thank you for correcting the tone of my question. I do appreciate it. You're absolutely right. I mean, the thing is it's just a horrific situation all the way around. And I think sometimes, we just make policy for the world that we live in, not necessarily the world that's out there, the real perspective that's out there. So, yeah. Any questions or yes, Eirini?
Yeah, the only thing I wanted to add is that, what Ms. Kouvelaki highlighted and the issues that Natalia, Dr. Linos highlighted, and one phrase that Mr. Bakoyannis said earlier resonated with me, which I truly believe in, the fact that when there is a crisis, I think it's also, you get the spotlight, you get on the spotlight, and some issues do get on the spotlight. And I think it is also an opportunity to build on the capacity that you use to face this crisis, but build on it so that you can have sustained force for the future. For example, intensive care units, or more staff was hired, more ventilators were procured, and this is something to stay. So in a lot of domains, Ms. Kouvelaki talked about child protection, and so policies that she's fighting for now can stay in place for the future. Same thing for all the social needs, so medical and social. And I think that for countries like Greece, I think it is a very smart way to build a lot of our health and social welfare systems from assistance and pathways that may start because of this unfortunate crisis.
Sometimes what's smart and what's politically expedient are not the same thing, unfortunately, and sometimes we forget that very quickly. And I mean, I'm going to go back to Ms. Kouvelaki. You mentioned that you got masks from China. How easy was that? Because we're seeing, like, even in the European context, they're now willing to entertain vaccines from Russia or from China, and there's a big political war on the vaccines and ventilators and masks a year ago.
Yeah, well, that was not easy, but it happened through private sector donations. I mean, we are lucky that, I mean, until now, we have been mainly funded by the private sector, and our donors are more like partners in our work, because we need long-term commitments and we really need to work together, because child protection issue needs a long-term approach and the sustainability. So that happened through that channel, because unfortunately the state was not prepared at the time to have adequate equipment. But now, I think more than a year later, we should take some measures. And just to give an example for our discussion, and to come back to Dr. Linos' point that we should not be making humans, we should not be, stigmatizing homeless kids or vulnerable people. And I know you didn't mean it that way in your question, but it's true. I mean, people say that, in a refugee camp, COVID is a luxury. Having COVID or being tested for COVID is a luxury, because there are so many other issues before that. But and to give you an example, very often it's not the kids that are coming from the streets that are transmitting COVID. Very often is our staff taking public transportation to come to work that bring in the virus. So I think now, a year later, there are measures that we know that work, and they can be implemented. So I think policymakers should revisit those measures, and we should never forget about the vulnerable populations and the invisible parts of our society, who play such a vital role in the well-being of everyone. And I think we've realized this the hard way this past year, but maybe to agree with my co-panelists, this crisis is an opportunity to set in place social and welfare policies that work for everyone.
Maria, you had a question?
Yes, I do have a question for the three guest speakers. You hear a lot people say that the cure cannot be worse than the disease, and we have seen that with people being at home, people are losing their jobs. There's like so much social inequity, and they oftentimes, that you guys have referred to, you say that that's the solution to decrease the infectious rates. So do you think, like, going forward, having a balance of people in the field and the epidemiology, the infectious field, and then people on the politics side, do you think there was ever going to be like a solution or a balance to, rule out that inequity while keeping people like from the infection?
I mean, Dr. Iliaki can probably speak more to this, but we are lucky that we have a vaccine. We have many vaccines, not just one vaccine that works. And so we don't have to have this constant fear or trade-off. So, I do think that is where we are going to be able to see the future, is in the vaccines. And if people are willing and able to take on the vaccination, then there's a light at the end of the tunnel. If they don't, that's a separate question. But I do think, and Dr. Iliaki said it earlier, that there's this false dichotomy between the economy and the cure being worse than the disease. If you are one of those people who have gotten sick, who have died, who are suffering, you don't think so. And because we are seeing the inequities of who is getting sick are those same people who are trying to protect, I don't think it's a fair enough assessment right now, but I am hopeful because of the vaccine.
Yes, I totally agree. I think the fact that vaccines are now accessible for some of the world, and that's where we have to fight for, to make them accessible for the rest of the world. I think that's the solution, the big solution to the problem. Thank you for the question.
Thank you guys for the answer.
Well, for us as well, I mean, I'm going to agree with the experts. We are looking forward for the vaccine. In Greece, it comes a bit later than the US. That's why on our end, we're trying to push forward and to advocate for the vaccination of at least of our staff and of the children under our care that suffer from chronic diseases and medical conditions. We haven't received any follow-up yet in our request, but we will remain hopeful and optimistic, and we will continue to push.
Yeah. A couple more minutes. I don't know if anybody has any additional questions as we are wrapping up. I do want to say that it just seems to me like I was just reading a New Yorker piece earlier today, and there was the idea was that plagues and pandemics have happened throughout, and it just seems that we go through this process as a humanity, and then we tend to forget and we recreate. It's almost like wars and pandemics, and we're in this repetitious cycle. And I think what I'm getting out of both panels is that the lack of preparedness has to do with the fact that we have pervasive inequalities in our societies that are really exposing themselves right now. And I'm not quite sure that we are, other than fixing it and moving to the next step, that we're really going to be able to address that in the way that it's going to eliminate the possibility of this kind of a pandemic coming up again in a more, I think in a greater frequency, I'm afraid, in the near future, rather than the other way around. Just some of the things, just the way that we have dealt with them, even with the vaccine. I think the vaccine is great. Having multiple vaccines has been great, but we also missing the point of how this vaccine was gotten, and the fact that there was a lot of cooperation on the part of governments and science and civil society and other organizations that we don't necessarily pay that much attention to prior to this time around. And I know you guys are, people on the ground sort of thing on the front lines, and I think it's great, but I'm not as optimistic that we'll have the memory required to make sure that we don't have the same challenges in a greater frequency in the future.
We quickly forget and become complacent, and so the future is so unpredictable in virus or any other catastrophes that could come. And this is what goes back to both the public and the political leaders have to be in sync, but also the scientists and the doctors and the healthcare providers have to pressure the political leaders to prepare for something like that, including all the other areas that are vulnerable. They are very harmful to the vulnerable of our societies, and especially some of the non-haves or non-able. And so it's very important to really direct the political leaders to become more to do their jobs rather than keep their jobs and trying to get reelected. And this is what has happened in our political system. And this is why we are in a situation that we're not able to prevent things. Thank you very much for the panel. Thank you, Madam, to the professor. Thank you, Maria. It has been a great, enlightening day.
Thank you. Any closing comments from our distinguished guests? I couldn't thank you enough again for accepting the invitation and having this conversation. I think we should have more of these conversations, certainly, and we should have them even beyond on many different levels. we sometimes we use a lot of voyeurism and look into what's going on in other people's lives, and we just tend to like, okay, we've done our part. But Sofia, the work that you are doing and have been doing with his children, I think it's just tremendous, and it must be very, very difficult at this time. I think we all owe you a great deal of respect, and thank you for doing this kind of work.
Thank you, Professor Vamvakas, and it's really important for us and for me to be, in this panel and to be able to discuss these issues with all of you. And I hope it's the beginning, and that we continue, because I think we have so many things to learn from you, and we need to keep exchanging views, because it's like we're building the plane and flying it at the same time. So I'm extremely grateful for this opportunity, and thank you very much for including me in this discussion.
Just before we close it off, again, I would like to thank our guest speakers. It was a really wonderful and insightful presentation. Thank you, Mr. Danis, for your wonderful questions. And I would just like to remind everybody that we also have a great event happening next week on Friday, April 23rd at 5 p.m.